This is Kate Brink reporting live with your Friday Health Highlights. Today's topic is a killer more deadly than prostate cancer, breast cancer, and AIDS combined. The topic today is sepsis treatment, and we'll have an expert come and talk to us about some of these treatment options. But first, what is sepsis? Sepsis is a complication of infections that are usually associated with the lungs, the kidneys, the skin, or the gut. This complications usually affect Sepsis usually affects patients who are very young or very old, and some symptoms of sepsis are shivering, fever, extreme pain, shortness of breath, sweaty skin, and increased heart rate. Each year, over 1 million Americans become septic, and 28 to 50% of these patients don't live. So since that's such an issue, we brought on Laura Davis, who is Bellarmine University's sepsis treatment expert.
Thank you, Kate. I'm so glad to be here today, and I'm just going to explain a little bit about my recent investigation into the treatment of sepsis. So I checked out 3 different resources, and pretty much overwhelmingly, the research supports the use of broad-spectrum antimicrobials as the most effective sepsis treatment. Adequate antimicrobial therapy is associated with lower mortality rates. However, the issue with this kind of treatment is the longer you use it, and because it is broad spectrum, it may lead to bacterial resistance in the end.
Can you tell us more about the resources you used for your investigation?
I sure can. So as I mentioned, I used 3 different resources to just kind of get all my research together. The first one I used was the National Guideline Clearinghouse, and they once again supported the general idea that you should use these broad-spectrum antimicrobials, and they suggest reassessment actually daily for potential de-escalation, and this is just an attempt to help present resistance and to reduce cost.
How long do you usually take these medicines for?
Usually the treatment is about 7 to 10 days. So as you are on these medications for 10 days, it can get pretty expensive. So the National Guideline Clearinghouse suggests if you keep taking these cultures, you can hopefully get the patient off treatment sooner rather than later and prevent higher cost. I also used another resource database called the Cochrane Database of Systematic Reviews. Cochrane pretty much said the same thing as my last resource said. I'm just suggesting doing cultures daily to shorten the length of the therapy and to prevent the resistance from happening. My last resource I used was called the Joanna Briggs Institute of Evidence-Based Practice Database. This one is a little bit different. They also supported the use of the broad-spectrum antimicrobials, but the main point of this was also incorporating EGDT into the treatment.
And what does that stand for?
EGDT stands for Early Goal Directed Therapy. So in addition to the antimicrobials, the goal is to use central venous catheterization in the hopes that they can monitor CVP and SCBO2. So they can also use the catheter to guide the use of IV fluids, because sometimes you'll need that, vasopressors, and also packed red blood cell transfusions. So even though this did show a reduction of 16% in mortality in addition to the antimicrobials, some people are still skeptical of the use of this extra treatment.
Sounds really expensive.
Exactly. That's why a lot of skeptics are out there. It's great that it has a reduction of 16% in mortality, but they didn't take into consideration underserved populations that don't even have access to basic health care. So it's an issue of if they have the resources available, if they don't even have the resources for the antimicrobial treatment. So regardless, no matter the recommendation, sepsis is the silent killer, and it needs to be treated immediately.
Thanks for coming and talk to us this week.
Thank you.